Thank you, Mr. Chairman, and thank you for referring to me as doctor, even though it was maybe by mistake. Um, I'm grateful for the panel and grateful for Dr. Jha and Mrs. Snay's testimony. Dr. Shah, you were kind enough to join me for a couple of teletown halls in the past few months, and you were sounding the alarm throughout in terms of our preparedness for and maintaining a state of readiness after we get through this first wave. But I want to ask about something different, just because it's been touched upon a bit. But as you well know, there's been a fair amount of misinformation around COVID-19. Some still claim it's no worse than a seasonal flu, which we all know that's far from the truth. Our president was prescribing hydroxychloroquine, despite the fact that it wasn't meant for use against COVID-19. And back at our last teletown hall several weeks ago, you gave another good example. You said, every day we hear from the president that we have enough tests, and we don't have enough tests. So I worry that the sum total of misinformation, as well as the diminished trust in public institutions from the White House right on down, it's harming our ability to effectively communicate the urgency of following proper health and safety protocols. And this misinformation may make it especially challenging for contact tracers who may be complete strangers to those from whom they are soliciting information. What can we do to combat this misinformation and increase our odds of ensuring the level of compliance necessary to beat COVID-19, both this current wave as well as the next if and when it comes?
So, Congresswoman Trahan, thank you, and thank you for having me on your teletown halls, which, as you know, I very much enjoyed. This is a huge problem. Look, the pandemic is hard enough, right? The worst pandemic in a century, combating it is hard enough. Throw in combating that on top of all the misinformation is making it extremely difficult. And as you said, we continue to have people downplay it. We continue to have people say that we have more than enough testing, more than enough capacity to deal with this. And yet the evidence is clear. 107,000 Americans have died as of this morning. We do not have this under control. So what would I like to hear? I would like to hear from our nation's scientists. We had, before this outbreak, the world's leading public health agency. I want to hear from the top scientists at the CDC. I would like to get a daily briefing from them about the state of the virus, the number of infections, and how our country is doing. We have not heard from the scientists at the CDC. Now, thankfully, we have heard from Dr. Fauci and Dr. Birx. There is nobody more respected than Dr. Fauci. I would be delighted to get a daily briefing from Dr. Fauci. But we need to get the science and evidence and data from the scientists. We need them in our public sphere, and we need, I believe, we need Congress to demand from the CDC and from the White House that scientists speak about the state of the virus and how it is that we're going to get our way through this very, very difficult time.